Hello everyone, my name is Erica Perales and I will be doing my presentation on coccidiosis immitis. Now to start off my presentation, I'm going to ask the question, did you know that there was a whole disease dedicated to the area in which we live in, being the Central Valley? And if you have ever felt sick, like you had the flu, especially after being outdoors during heavy winds which lift the dirt, if so, then this presentation will be relevant to you. Now, the reason why I chose this pathogen C. immitis or coccidiosis immitis was really because I had heard it somewhere, really wasn't sure what it was or where I had heard it, and it just sounded interesting and I really wanted to know more about it. So C. immitis is classified as a fungi. As you can see, it does belong to the fungi kingdom. It is the only one of its kind to belong to the Coccidiosis genus, and there really are only two types of strains, one being Coccidiosis immitis and the other being Coccidiosis pediasis. Now, each strain pertains to a different area, one being the Californian and the other being the non-Californian. C. immitis would be the Californian strain, and C. pediasis would be the non-Californian strain. They both do the same thing, just in different parts of the country. C. immitis is classified as a dimorphic fungi, meaning that it can take up two forms, one being the mycelial form and the other being parasitic. The mycelial form takes place outside of the host, such as the soil, and the parasitic form takes place once in the host's body. C. immitis is a rapid grower. It really depends on the temperature in which it is found. Usually ranges between 25 degrees Celsius to 37 degrees Celsius, and it grows in colonies. The habitat of C. immitis usually is one with high levels of soil, hot temperatures, dry weather with occasional heavy rainfall, which really sounds like the desert. And some areas that really do meet the requirements would be the San Joaquin Valley, southwestern parts of the US, Mexico, and South America. Now, the southwestern parts of the US include the states Arizona, Nevada, and Texas. C. immitis usually prefers an alkaline soil, and it can withstand temperatures ranging from negative 40 degrees Celsius to 48 degrees Celsius. Now to the interesting part is, what disease does C. immitis cause? Now C. immitis causes what we know as valley fever, and it is classified as a cocci infection. It is a pulmonary disease in which the fungal spores grow and multiply within the lungs. It can either enter the body being one of two ways, one being it can be inhaled, and the other being that it can enter through open wounds. Now, that way really is rare, but it can happen, just not as much. Like I mentioned before, that we inhale the mycelial form, and once in the body, it becomes the parasitic form. How it becomes the parasitic form is that the body temperatures of 37 degrees Celsius really allow for the growth of the spores, and they can grow up to 100 micrometers to the point where they burst, releasing hundreds of endospores, which can range in size being up to 5 micrometers. Now, once in the body, how does it combat the infection? It really comes down to macrophages and neutrophils, and their job is to phagocytize the pathogen. But C. immitis can evade being phagocytized due to its glycoprotein wall and its ability to reduce the production of antimicrobial oxidants produced by macrophages. What do macrophages produce? They would be hydrogen peroxide, nitric oxide, and hypochlorous acid. The signs and symptoms of valley fever are really like those of the flu. They include fever, cough, fatigueness, shortness of breath, headache, muscle and joint pain, and in some cases, many will experience a rash. Um, However, 60% of the people who become infected will remain asymptomatic and never know they were infected. The symptoms can take a couple of weeks to show once being infected and can usually last up to a couple of months. C. immitis or valley fever can either range from being acute to chronic. It really depends on the health status of the host, and it can also become disseminated, being that it has spread from the initial site of infection, being the lungs, throughout the whole body. Valley fever really isn't contagious, and once you have valley fever, your body will develop immunity. Real will develop immunity, and the next time you get it, your symptoms won't be as severe. Now, relapse or reinfection is rare, but it can still happen. It's just rare. The risk groups, they really aren't, valley fever really isn't limited to humans. Animals can also get it, and it is very common in household pets. But you can't get it from animal to human or human to animal. It's just done through the inhalation of the spores. People living or traveling in areas with high levels of soil are at a higher risk. Also, those living in the mentioned areas in which there are high levels of wind, which causes the soil to be lifted and for spores to be floating in the air, making it easier to be inhaled. The immunocompromised are also at a higher risk. They include those with HIV, those taking medications, diabetics, and those who have had surgery, especially those who have undergone transplants. The elders ages 60 and up are also at a higher risk, as well as pregnant women. Valley fever is most common in men than it is in women. Usually people or males of Filipino descent, African Americans, Mexican Americans, and Native Americans are the most reported cases. And agricultural and construction workers are also at a higher risk due to the fact that they work in an environment in which the soil is constantly being lifted. As far as treatment and prevention goes, there really isn't much one can do about it. There is no vaccine, but there are studies taking place right now looking for a vaccine or a cure. Usually, valley fever will self-resolve on its own, and if you do need treatment, your doctor will prescribe you either one of two drugs, being fluncazole and intracazole, and they would be taken at X amount of doses for X amount of days, and you must take the full form of the treatment as prescribed. And if valley fever progresses to chronic and disseminated, your doctor will use intravenous atmosferin B, but that really isn't a cure or treatment. It's just for the worst of cases. And you really can't self-diagnose valley fever. You would have to go in and get tested by a doctor, and from there, the doctor will either do a sputum and or a smear test to determine that you have valley fever. Um, as far as preventing infection of valley fever, you can only take precautionary means to reduce the likelihood. You can reduce your time being outdoors, especially during windy times. Like I said before, the wind would lift the soil, um, leaving the spores out floating in the air. And you could cover your face with a mask, or basically just cover anything that would be the mouth and the nose to avoid inhalation of the spores. And you could cover open wounds. There is my works cited page, And to end my presentation, I leave you with these questions.